discloses the Canadian healthcare system isn't actually free. So why is this considered a norm in society? Well, the media and the news contribute to a large part of that norm. Every time someone looks up the Canadian healthcare system, the word free is often connected with those articles, sources, and in the media news. Although about 70% of our healthcare system is considered free, the 30% we do have to pay for is medications, dental, and eye care. However, not everyone needs that 30% of that healthcare, so it's often forgotten. This is a systematic error because if you don't have employment insurance or any insurance at all, the cost of these could get very expensive if it's not covered, and the word free is nowhere in sight. In addition, for Canadians, we assume that we have free healthcare because it is often forgotten that we pay for our healthcare through our territorial and provincial taxes. Many Canadians pride ourselves and our country because of the healthcare system that we have, that the word free is often misused when describing the truth about how free the healthcare system actually is.
The Canadian government requires each province to outline their provincial healthcare benefits that must include things like primary care doctors, hospitals, surgeries, and specialists. However, provinces don't have to include things like routine dental care, physical therapy, prescription drugs, and other healthcare necessities. According to Organizations for Economic Cooperation and Development, about 30% of Canadians pay an additional money out of their pockets for healthcare purposes, including private insurance. This goes to show that healthcare in Canada is not free, and Canadians are caught paying for all the essentials that are not covered under the provincial plan. Private insurance plans are purchased for anywhere between $3,994 to $12,410, depending on your family size and annual income. These plans allow coverage for things like prescription drugs, therapy, dental care, eye care, and other health issues that need extra medical attention. Unfortunately, 6 out of 10 provinces in Canada do not allow private insurance at the time of purchase, and instead have to pay the costs out of their pockets and submit to their insurance company for reimbursement. If you cannot afford extra insurance, you're required to pay for the extra medical care you need. This can create a lot of financial stress due to the high costs that need to be paid for essential health care that often isn't planned for. For example, if you're sick, you often don't know you're going to be sick ahead of time. If you need to go to the doctor, you'll probably get a prescription for antibiotics or other medication to help with your illness. Because you went to the doctor, you will probably have to miss work and therefore you're losing income. If you don't have insurance or you have to reimburse your receipt, you are out money until your reimbursement comes, or if you don't have insurance, you will be stuck paying for the cost of your prescription out of your pocket.
In 2017, the estimated average payment for public healthcare insurance ranges from $4,000 to $12,000 for 6 common Canadian family types, depending on the type of family. The 10% of Canadian families with the lowest incomes will pay an average of about $471 for public health care insurance in 2017. The 10% of Canadian families who earn an average income of $63,000 will pay an average of $6,000 for public health care insurance. And the families among the top 10% of income earners in Canada will pay almost $40,000. Healthcare in Canada is not free. While Canadians may not be billed directly when they use medical services, they pay a substantial amount of money for healthcare through the country's tax system. One reason why Canadians don't know the true cost of healthcare is because the physician and hospital services that are covered by tax-funded healthcare insurance are free at the point of use. This situation leads many people to grossly underestimate the true cost of healthcare. When people speak of free healthcare in Canada, they are entirely ignoring the substantial taxpayer fund cost of the system. Healthcare in Canada is financed through general government revenues rather than through a dictated tax.
Health in Canada is often perceived as easily accessible and free for all, but that is definitely not the case. Many rural communities and Aboriginal people living on reserves are in poor health status because of their lack of health care provided in their areas. This is the result from centuries of oppression. Throughout Canada, most health information is transferred through media outlets, television, and printed materials, which can be problematic for remote communities and communities with low rates of literacy. Another problem is the distance rural residents must travel to medical facilities. Traveling requires more time and money.